Thank you for being here today, and welcome to this presentation on the impact of demographic variables on the use of non-pharmaceutical interventions. The learning outcomes of this presentation are as follows. First, we will develop an understanding about what NPIs are and how they affect society during a pandemic. Secondly, we will discuss segments of the market and their effect on NPI usage. We will then review the theoretical framework that guided this study, followed by discussing the relevant data collected, and lastly, we will touch on some of the limitations and practical implications of the research. The Canadian government, the World Health Organization, and the Centre for Disease Control confidently recommend non-pharmaceutical interventions as the most effective strategy towards decelerating the spread of the COVID-19 virus and in turn, flattening the infection rate curve. Why then does the spread of the coronavirus continue to increase and our nation's curve continue to go up? Perhaps this is due to the varying rates by which individuals adopt these NPI measures. This study argues that demographic variables such as age, gender, education, ethnicity, and population density play an influential role on the adoption and usage of non-pharmaceutical interventions. It is important that we start by defining what we mean by non-pharmaceutical interventions, or NPIs as we will refer to them as. The CDC defines NPIs as actions apart from getting vaccinated and taking medicine that people and communities can take to help slow the spread of illnesses like pandemic influenza. Common examples of NPIs that have been widely encouraged during the COVID-19 pandemic are personal protective equipment such as face masks or face shields, increased sanitization of hands and common touch points, social distancing of at least 6 feet, and quarantine or isolation of oneself. Fred Davis's technology acceptance model is used as the theoretical framework of this study to examine the demographic variables that influence consumer adoption of NPIs. This is a widely accepted theory that has been commonly used when assessing the adoption of new products. This model suggests that when users are presented with a new technology, a number of factors influence their decision about how and when they will use it. First, perceived usefulness. In this case, this refers to whether or not an individual perceives NPIs to be useful towards mitigating the spread and contraction of the COVID-19 virus. Next, perceived ease of use refers to the degree to which a person believes that using NPIs would be free from effort. Whether or not the NPIs are easy to use is likely to affect individual attitudes towards usage. These attitudes towards usage and societal norms will affect the likelihood of an individual to adopt new NPIs. Behavioral intentions refer to the motivational factors that influence a given behavior. In this case, the more likely an individual's intention to use NPIs, the more likely that that behavior will be performed. Working in coordination with the technology acceptance model are 3 major adapter categories that influence rate of adoption of new products. These categories divide consumers into segments based on their willingness to try a new innovation or product. This is part of the diffusion of innovations theory that has been applied to several studies, including in marketing. First, there are voluntary adopters. These are individuals that adopt NPIs without any external influence. Next, there are influence adopters. These are individuals whose adoption of NPIs is heavily based on the information and recommendations they receive from healthcare officials, celebrities, politicians, family, and friends. Lastly, involuntary adopters are those who resist the adoption of NPIs. It is this category of consumers that lead governments to implement more strict legislation regarding NPI measures. This study was conducted by collecting data from 278 respondents using a virtually distributed snowball method survey. Cochrane's formula was used to determine the adequacy of our sample size, and a partial least squares approach to the structural equation model was used to analyze the relationships simultaneously. Using an HTMT analysis of correlations along with bootstrapping measures applied to the test significance together serve to confirm discriminant validity. Effect size is a statistical concept that measures the strength of the relationship between two variables on a numeric scale. In this table, we can see that the effect size for the relationship between the age demographic and the actual usage of NPIs shows a significance. And this is the most important finding in the statistical analysis of this study. It supports the hypothesis that the age demographic proves to have a significant effect on the actual usage of NPIs. Additionally, the path coefficient here indicates a causal linkage between the age demographic variable and actual usage of NPIs. Some research limitations of the study include sampling. And while our sample size is suitable based on the PLS-SEM measurement and Cochrane's formula, the collection of more responses may lead to finding significance between other demographic variables tested and actual usage of NPIs. In the case of sample size, a larger sample is likely to produce a more accurate reflection of the population at study. In particular, with a larger sample size, this study may find additional supporting data for the hypothesis in terms of the other demographic variables. Additionally, the survey method used can be subject to biases due to limited sampling and respondent availability. Certain demographics are less likely to have internet access, and certain demographics may be more or less likely to respond to online questionnaires. This research has successfully identified a relationship between age and use of NPIs during the COVID-19 pandemic. Specifically, it has revealed that individuals belonging to older generations are more likely to adopt the usage of NPIs than those belonging to younger generations. So, how can we use this information in a meaningful way moving forward? We have identified a need to specifically engage Canadian youth in order to increase adoption of NPIs, thereby improving their overall effectiveness. Provincial governments may want to launch interactive social media campaigns that highlight the importance of NPIs in a way that is appealing to that generation. Additionally, younger generations may be more likely to wear a face mask, for example, if pharmaceutical companies teamed up with fashion brands, celebrities, and other influential personalities to design, endorse, and model PPE. It should also be noted that vulnerable youth are likely to have financial insecurities and limited access to resources during a pandemic, and this may be a reason for a lower adoption rate. To aid in the implementation of NPIs within this demographic, governments could institute subsidized rates for vulnerable youth, and corporations could introduce corporate social responsibility initiatives to aid in the distribution of PPE to this proportion of the population. The knowledge gained from the results of this study provide valuable insight into the mitigation of viral spread through NPI measures. Specifically, we are able to further understand that an individual's age is likely to have a significant effect on adoption of NPIs. To conclude, this study finds evidence in support of its hypothesis that age plays an influential role in the adoption and use of NPIs during the COVID-19 pandemic. Thank you kindly for your attention throughout this presentation.